Okay, let's unpack this. We're diving into a scientific paper today, one that takes a really hard look at colonialism, not just as history, but as something, well, actively shaping global health right now.
That's right. It's titled Developing an Agenda for the Decolonization of Global Health.
And the authors are David McCoy, Anuj Kapilashwamy, Rami Kumar, Emma Rule, and Rajat Khosla.
Indeed. And their goal really is to lay out how colonialism persists and, crucially, what can be done about it.
Especially for those of you listening who are working directly in healthcare, right? On the front lines.
Precisely. What's really interesting is how they kick things off. They challenge that common idea of colonialism just being about, past empires.
Flags and conquests and that sort of thing.
Exactly. Instead, they frame it as a continuing system, a system of power where one group dominates another, mainly to extract resources.
Okay, extraction. That sounds key. What exactly do they mean by resources here? Is it just like minerals or land?
Well, yes, those tangible things like land and labor are part of it,
Right.
but they define it more broadly. It's the systematic taking of wealth or resources. And that includes increasingly less tangible things. Think knowledge. Think data.
Right. Knowledge and data, all for the benefit of the dominant group, presumably.
Disproportionately, yes. That's the core of it.
So it's an ongoing process, not just a finished chapter in history. And they connect this to modern concepts, too. I think I saw neocolonialism mentioned.
You did. They draw a clear line to it. Neocolonialism meaning that continued outflow of wealth from countries that are, on paper, independent.
Right. No longer formal colonies, but the wealth extraction continues. How?
Often through indirect means. Economic leverage, debt, trade rules, that kind of thing. And the paper links this very strongly to, capitalism's drive for profit and accumulation.
And it's not just international, is it? They make a point that this can happen within a country, too.
Absolutely. Certain groups within a nation can face very similar dynamics of domination and extraction.
So, okay, this is the theory. How does it connect directly to, say, a health clinic or a hospital system? That seems like the crucial link for our listeners.
That's exactly where the paper pivots. It argues that global health itself, the structures, the systems, even the funding flows, can become channels for these very extractive practices.
Wow. So not just historical stuff like, tropical medicine helping empires run things.
No, beyond that. They're talking about how wealth can be extracted through the health sector today.
Okay, so this leads to their main contribution, right? This three-part agenda for action, for actually doing something.
Yes, a framework to guide decolonization efforts in global health. Let's break it down, thinking about what it means for someone working in the field.
Sounds good. What's the first part?
First, they talk about colonialism within global health. This is really about the power imbalances and relationships between institutions, often.
Like between big organizations in high-income countries and maybe local clinics or health departments in lower-income settings.
Exactly that. Think about some common scenarios. The paper points to things like parachute research.
Where researchers fly in, get their data, and fly out, maybe without much real collaboration or benefit for the local partners.
Precisely. Or consider how funding from big international donors can sometimes end up shaping local health priorities. Maybe pushing certain programs or targets that don't perfectly match the community's own felt needs, subtly steering your focus. The authors argue this perpetuates old inequalities.
Okay, that's the within part. What's next?
The second part zooms out. It's about the colonization of global health. This looks at the bigger picture, who actually holds the power in global health governance.
So institutions like the World Health Organization, big foundations, that sort of thing, and what ideas get promoted.
Who sets the agenda? The paper highlights the significant influence of wealthy countries and powerful private actors like large corporations.
And the argument is this can skew the agenda.
Yes, potentially towards interventions that are, shall we say, more profitable, maybe specific drugs or technologies, rather than focusing on the deeper reasons people get sick.
The structural drivers.
Right.
Like poverty, inequality, lack of clean water.
Exactly. The things that often require political and economic change, not just a technical fix. The paper links this focus back to that underlying drive for extraction and profit.
Right. Okay, so that's within and of. What's the third piece?
The third part is colonialism through global health. And this might feel the most immediate for many listeners. It's the idea that the health sector itself becomes a site for exploitation and wealth extraction.
You give some examples they use?
Sure, they point to things like the huge profits made during health crises. Think about the debates around COVID-19 vaccine pricing.
Okay, yeah.
Or the trend towards privatizing healthcare services, where public funds might end up boosting private profits. They also mention pressure on health worker salaries and working conditions.
So essentially, wealth being pulled out of the health system.
Pulled out or accumulated in ways that don't necessarily improve overall health equity. And this, of course, directly impacts the resources you might have available, the conditions you work under.
So it's quite a systemic critique. What's the call to action then? Is it just about awareness?
It's much more than that. McCoy and his colleagues argue that real decolonization needs political and economic shifts. It's about fundamentally challenging those power imbalances that allow the extraction and profiteering to happen.
Not just cultural sensitivity training then.
No, it goes deeper. They actually point back to movements like the one behind the Alma-Ata Declaration in the 70s.
Focused on primary health care and equity.
Yes, suggesting it had a kind of anti-colonial spirit focused on justice and equity as core health principles.
So wrapping this up, what's the main takeaway for someone listening?
Well, the authors McCoy, Kapalshrami, Kumar, Rule, and Khosla are really pushing us to see decolonization as an active process. It means tackling these deep-seated power issues and the economic exploitation that runs through global health, both locally and globally.
It challenges us to look beyond the immediate symptoms or diseases and see how wealth extraction, linked to history, but also present-day capitalism, might actually be operating through the health sector itself. Which leaves us with a pretty big question, really, for you listening. How might understanding these broader forces, this idea of extraction, change how you view the everyday challenges and inequalities you face in your health work?